السلام عليكم ورحمة الله وبركاته. Welcome my daughters and sons. We will start to discuss chemotherapeutic agent. This is the first lecture in this subject. What's chemotherapy? Chemotherapy, the word describes cancer chemotherapy and antimicrobial chemotherapy. In this chapter, we will discuss antimicrobial chemotherapy. What's antimicrobial chemotherapy? It is the use of the chemotherapeutic agent to prevent or treat microbial infection in humans. Antimicrobial agents are classified according to the microorganism into antibacterial, antiviral, antifungal, and antiprotozoal. Selective toxicity of antimicrobial agent means that the drug exerts its toxic effect only on the microbial cell, without causing any toxic effect on the human or the host cell. Some antimicrobial agents may produce toxic effect on the human cells, but at doses much higher than those which affect microbial cells. Why? Because antimicrobial agents have high therapeutic index. What this mean? What's the meaning of high therapeutic index? This is a question for you. Antibacterial agents. Antibacterial agents, one type of antimicrobial chemotherapeutic agent. They are classified according to the origin, and they can classified according to spectrum, and they can classified according to mechanism of action. There are several classifications of antibacterial agents. Classification according to origin. Antibacterial agent classified into natural, semi-synthetic, and synthetic antibacterial agent. Synthetic antibacterial agents are completely synthetic chemical compound. They are manufactured in the factory. They are completely synthetic without natural source. This includes sulfonamide and fluoroquinolones. In contrast, antibiotics, which are natural chemical substances produced by fungal or bacterial cells and have toxic effect against another microorganisms. This means antibiotics are chemotherapeutic agents that produced by microorganisms against other microorganisms. Synthetic modification is done to increase antibacterial spectrum or to increase antibiotic stability or to improve the pharmacokinetics of antibiotic. In this case, this antibiotic called semi-synthetic antibiotic. Semi-synthetic because I do some synthetic modification to the natural one. Antibiotic are the natural chemical substance. So all antibiotics are chemotherapeutic agent, and the reverse is wrong. Not all chemotherapeutic agents are antibiotics. Classification of antibacterial agent according to the effect on bacterial cell. I can classify antibacterial agent into bacteriostatic and bactericidal agent. Bacteriostatic, which inhibit growth and multiplication of bacterial cell without producing lethal effect. So the eradication of bacterial cell depends on the host immune system. I need effective immune system. If I choose to treat this infection with bacteriostatic agent, so I can't use bacteriostatic agent in immunocompromised patients, as patient with AIDS, diabetes, prolonged glucocorticoid therapy, because in this patient the immune system is weak. In contrast, bactericidal agents, they have lethal effect on bacterial cells and do not need too strong immune system. It depends on itself to damage the bacterial cell. I can classify antibacterial agent according to mechanism of action. It can classified into antibacterial agents that act as anti-metabolic agent which inhibit certain metabolic process in the bacterial cell. They are mostly bacteriostatic. For example, sulfonamide. Do you remember sulfonamide from the first term? Mechanism of action of the drug. Sulfonamide is an example for drugs that inhibit or interfere with metabolic pathway. The second type of antibacterial agent according to mechanism of action is the inhibitors of bacterial cell wall synthesis. They are bactericidal as beta-lactam antibiotics. Antibacterial cells may act by inhibition of bacterial protein synthesis, and they are bacteriostatic as tetracycline, chloramphenicol, macrolides antibiotic. And there is some exception in this case. We will discuss it in its lecture. Antibacterial agent may act by disruption of cell membrane permeability, and in this case this antibacterial agent acts as bactericidal agent as polymyxin. Lastly, antibacterial agent may act by inhibition of nucleic acid synthesis, and in this case it acts as a bactericidal agent as fluoroquinolones and rifampicin. Concentration of the antimicrobial agent and sensitivity of bacterial cell are other factors which determine the antibacterial action, static or cidal. This means some antibacterial agents act as bacteriostatic agent in low dose and bactericidal agent as high dose. For example, erythromycin. Erythromycin is one of bacterial protein synthesis inhibitor, the one of macrolides, which act as bacteriostatic in low dose and bactericidal in high dose. This is the structure of bacterial cell. This is the cell wall, cell membrane, plasma membrane, cytoplasm, which include DNA and ribosomes. And from this figure, we can classify the antibacterial cell according to mechanism of action into antibacterial agents that act on cell wall. The second mechanism is antibacterial agents that act by inhibition or disruption of plasma membrane. The third group is antibacterial agents that inhibit protein synthesis, and the fourth group is antibacterial agents that act on DNA synthesis. This is the four groups or four types of antibacterial cells according to mechanism of action. Antibacterial agent can be classified according to the spectrum. Narrow spectrum agents, which are active only against a specific group or specific microorganisms, may be gram-positive or gram-negative bacteria. Broad spectrum agents, they are active against both gram-negative and gram-positive bacteria. Extended spectrum agents, which affect bacterial strains commonly resistant to other antibacterial agents, as Pseudomonas. What do you prefer to use, narrow spectrum or broad spectrum antibacterial agent? It's a good question. we prefer narrow spectrum. They are specific for certain microorganisms. I do culture anti-sensitivity tests, and according to this culture anti-sensitivity test, I choose the antibacterial agent which the bacteria is sensitive to it. But I can use broad spectrum in case of severe infection and diagnosed infection when I can't cause or can't specify or I can't diagnose the cause of this infection. In this case, I use broad spectrum agent. But broad spectrum antibacterial agent is very liable or are very liable to reduce resistance. So I prefer narrow spectrum antibacterial agent. Resistance to antibacterial agents. Acquired resistance of previously sensitive bacteria is a major clinical problem. It is either due to spontaneous mutation or plasmid-mediated resistance. When I use an antibacterial agent, it gives me good result at first, then this bacteria show resistance against this antibacterial agent. Why it show resistance? Why the resistance occur? It may be due to spontaneous mutation or plasmid-mediated resistance. And the plasmid-mediated resistance is the common cause of resistance. Plasmid. What's the meaning of plasmids? Plasmids are extrachromosomal genetic material, which include or plasmid or resistant plasmid responsible for resistance to certain antibacterial agents. This R plasmid is transferred to sensitive bacteria during conjugation and produce several actions. It may cause decreased permeability of bacterial cell wall to antibacterial agent, and so it prevents entrance of antibacterial agent into the bacteria, or enzymatic degradation of antibacterial agent, and this enzyme which is produced by the bacteria can cause metabolism or degeneration of antibacterial agent, or it causes rapid efflux of the antibacterial agent from the bacteria, or modification of the binding site inside the bacterial cell. When antibacterial agent act on bacteria, it first combined with specific binding site. If this specific binding site is modified, so the antibacterial agent not work. And so the mechanisms of resistance include decreased permeability of bacterial cell wall to antibacterial agent, enzymatic degradation or breakdown of antibacterial agent, rapid efflux of antibacterial agent, and the modification of the binding site inside the bacterial cell. Antibiotics. Antibiotics mean natural chemotherapeutic agents. That include beta-lactam antibiotics. Beta-lactam antibiotics include penicillin, cephalosporins, monobactam, carbapenems. But generation of penicillin, cephalosporins, monobactam, and carbapenems may be not actually natural chemotherapeutic agent, but it's semi-synthetic. Scientists do modification to increase the activity of these or to avoid destruction of these antibacterial agents. So the term antibiotic as a titre of this lecture is not true. I must change it into chemotherapeutic agent. First group of chemotherapeutic agent is beta-lactam antibiotics. Beta-lactam antibiotics include penicillin, cephalosporins, monobactam, carbapenems. They contain beta-lactam ring in their chemical structure, which is essential for their antibiotic activity. Acidic or enzymatic breakdown of beta-lactam ring lead to loss of antibacterial activity. So, all these chemotherapeutic agents, penicillin, cephalosporins, monobactam, carbapenems, include beta-lactam ring in their chemical structure, and this beta-lactam ring is essential or is responsible for their antibiotic activity. So, if I destroy this beta-lactam ring, these chemotherapeutic agents will lose their activity. This is the chemical structure of beta-lactam antibiotics or beta-lactam chemotherapeutic agent. This is the beta-lactam ring in penicillin, cephalosporins, monobactam, and the carbapenems. Beta-lactam ring in penicillin and the cephalosporins are liable to destruction by beta-lactamase, but beta-lactam ring in monobactam and the carbapenem are resistant to beta-lactamase. What's beta-lactamase? Beta-lactamase is an enzyme that is responsible for destruction of beta-lactam ring, and several bacteria can produce it, as Staphylococcus aureus. Mechanism of action of beta-lactam antibiotics. Beta-lactam antibiotics or chemotherapeutic agent are bactericidal, acting by inhibition of cell wall senses. They pass the bacterial cell wall through specific purines because they are hydrophilic and not lipophilic. They can't cross plasma membrane, they can't cross cell wall. They enter the cell through purines and bind covalently to the active site of penicillin binding protein in the cell membrane, which contain transpeptidase activity, which is responsible for cross-linking of peptidoglycan chain that give the cell wall its structural rigidity. This is mean all beta-lactam chemotherapeutic agents are responsible or act on the inhibition of the third stage of cell wall senses. Cell wall senses occur in three steps. The first step is de-alanine formation or senses. The second step is elongation of peptidoglycan. De-alanine combined with N-acetylmuramic acid plus N-acetylglucosamine, and this causes elongation of peptidoglycan. In the second step, this elongated peptidoglycan is transferred outside the cell on the outer surface of the plasma membrane, and it needs a carrier for this process. Several layers of peptidoglycan are transferred outside the cell, but they need binding to each other. They are in this stage loose and can be easily destroyed. They need cross-linking to bind them together and to give the cell wall its structural rigidity. This step is the third step. Cross-linking of peptidoglycan chain is the third step in formation of the cell wall. And the beta-lactam antibiotics or chemotherapeutic agent act on this step, act on inhibition of the formation of cross-linking of peptidoglycan chain. and so this peptidoglycan lose their rigidity and they become loose and easily destroyed. Beta-lactam inhibit transpeptidase enzyme. This enzyme is responsible for cross-linking. Therefore, bacterial cell wall become weak and easily ruptured due to high osmotic pressure within the cell, as compared with external environment. Mammalian cells have no peptidoglycan chains, and so beta-lactam chemotherapeutic agents are selectively toxic for bacterial cells. This is the layers of peptidoglycan, and this is the cross-linking arranged vertically, peptidoglycan arranged horizontally, peptidoglycan layers, and this cross-linked arranged vertically to bind these peptidoglycan layers together. This is plasma membrane, and the formation of this cell wall, which is formed of peptidoglycan layers, occur in cytoplasm, and this peptidoglycan layer transfer across cell membrane or plasma membrane to outside the cell and arranged in several layers outside the plasma membrane, and then cross-linking formed to give the cell wall its structural rigidity. This is peptidoglycan layers formed of D-alanine, which combined with N-acetyl muramic acid plus N-acetyl glucosamine, and arranged as you see in layers, and these layers bind together with these cross-linked as you see in color, in green color. And this figure of peptidoglycan layer arranged vertically, which is formed of D-alanine plus N-acetyl muramic acid plus N-acetyl glucosamine. Peptidoglycan layer in this figure arranged vertically, and these are the cross-linking in red or in green color. Resistance, plasmid mediated resistance, may be resistance produced against beta-lactam chemotherapeutic agent, and this resistance is plasmid mediated resistance due to enzymatic degeneration of beta-lactam ring by beta-lactamase. Is the most common mechanism. Do you remember the mechanisms of resistance, which include decreased permeability of the bacteria to antibacterial cell, enzymatic degeneration of antibacterial agent, rapid efflux of antibacterial agent, or modification of binding sites of antibacterial agent. In case of beta-lactam antibacterial agent, the most common mechanism to produce resistance is enzymatic degeneration. Enzymatic degeneration occurs by beta-lactamases. There are several types of beta-lactamases, may reach 300 beta-lactamases, and these beta-lactamases produced by several types of bacteria. It acts against the antibacterial agent. It can destroy antibacterial agent. These beta-lactamases include penicillinases, which inactivate penicillin, and commonly produced by Staphylococcus aureus, and cephalosporins, which inactivate cephalosporin and commonly produced by Escherichia coli. Other organisms known to produce beta-lactamases as Haemophilus influenza, Neisseria gonorrhea, Pseudomonas. Beta-lactamase inhibitor as clavulanic acid, and sulbactam. This structure contain beta-lactam ring but lacking antibacterial activity. They have clavulanic acid and sulbactam, which are beta-lactamase inhibitors, contain beta-lactam ring in their chemical structure, but they lack antibacterial activity, or their antibacterial activity are very weak. They act as suicidal inhibitors, which bind to and inhibit beta-lactamase, and thus protecting the antibiotic from inactivation. They sacrifice by themselves. They give themselves to beta-lactamases and destroy it instead of penicillin. So they sacrifice themselves and protect the chemotherapeutic agent. And so they act to prolong the duration of action of chemotherapeutic agent. Beta-lactamase inhibitors are mostly active against penicillinases, but many cephalosporins are resistant to their action. And so I can combine beta-lactamase inhibitors with penicillin, because beta-lactamase inhibitors are mostly active against penicillinase, but no drug in the market contain beta-lactamase inhibitors and cephalosporins, and this due to that they are not very active against cephalosporinases, because cephalosporinases are resistant to their action. Penicillins are type of beta-lactam chemotherapeutic agent. I can classify there are penicillins into several groups. Penicillins include natural penicillin, penicillinase resistant penicillin, broad-spectrum penicillin, and anti-pseudomonal penicillin. First, natural penicillins. Benzyl penicillin or penicillin G, which is a narrow-spectrum agent. It active against gram-positive bacteria, but gram-negative are mostly resistant to penicillin G. It is acidly bile, so I can't use it orally. It destroyed by gastric HCl, so used only parenterally by intramuscular or intravenous administration. Penicillin G is penicillinase sensitive. It is easily destroyed by bacteria that produce penicillinase enzyme, so it is not used for staphylococcal infection, and it has short duration of action. So penicillin G, it is beta-lactam chemotherapeutic agent. It has narrow spectrum, active against gram-positive, not gram-negative bacteria. I can't take it orally, only by injection. It is penicillinase sensitive. I can't use it in treatment of staphylococcal infection. It has short duration of action. This is 5 notes you must know about penicillin G. Natural penicillins include broken penicillin G. It is used as single intramuscular injection every 24 hours. It has longer duration of action than penicillin G. Benzazine penicillin G, it's used as single intramuscular injection every 3 to 4 weeks. It has the longest duration of action of penicillin G types. The second group is penicillinase resistant penicillin. Penicillinase resistant, this type of penicillins can't be destroyed by penicillinase, which produced by certain type of bacteria. So they can use in treatment of this type of bacteria. They can use in treatment of bacteria produce penicillinase enzyme as staphylococcal infection. These penicillins include methicillin, which is acidly bile, destroyed by gastric HCl. I can't take it orally. And also include nafcillin and cloxacillin, which are acid stable. They can be used orally. They all are used mainly to treat infection caused by penicillinase producing staphylococci. They all are anti-staphylococcal penicillins. The third group of penicillin is amoxa broad-spectrum penicillin, which include amoxicillin and ampicillin. They are broad-spectrum agent. They are acid stable. I can take it orally. They are not destroyed by HCl. They are penicillinase sensitive. They can be destroyed by penicillinase enzyme, and so I can't use them in treatment of penicillinase producing bacteria as staphylococci. So they are used in combination with beta-lactamase inhibitors in treatment of infection caused by penicillinase producing bacteria. The commonly used combination are amoxicillin plus clavulanic acid and give us augmentin, ampicillin plus sulbactam produce unicin. This is good combination, amoxicillin plus clavulanic acid and ampicillin plus sulbactam, because I use beta-lactam chemotherapeutic agent with beta-lactamase inhibitor, so I protect beta-lactam chemotherapeutic agent from destruction of beta-lactamase enzyme. The fourth group of penicillin is anti-pseudomonal penicillin. The third group, which include broad-spectrum agents, they are broad-spectrum. They active against most type of bacteria except cobab, KBB, except Klebsiella, Proteus, and Pseudomonas. Broad-spectrum penicillin active against most of bacteria except cobab, KBB, Klebsiella, Proteus, and Pseudomonas. And so the fourth group is anti-pseudomonal penicillin. Piperacillin and ticarcillin, they are broad-spectrum agent affecting cobab, affecting KBB, affecting Klebsiella, Proteus, and Pseudomonas. And this group called anti-pseudomonal penicillins. They are acidly bile, so I can't use them orally. They destroyed by gastric HCl. I use them parenterally, and they are penicillinase sensitive, so I use them in combination with beta-lactamase inhibitor to protect them from destruction by penicillinase producing bacteria. Pharmacokinetics of penicillin. As you know, pharmacokinetics include absorption, distribution, metabolism, and excretion. Absorption differ according to the group of penicillin. Some penicillins are acidly bile and the others are acid stable. Some are acidly bile as penicillin G. It's a type of penicillin, or this type of penicillin can be destroyed by gastric HCl, and so I can't take it orally. But broad-spectrum penicillin as amoxicillin and ampicillin are acid stable, so I can use them orally. But Amoxicillin is preferred for oral use than ampicillin due to better gastrointestinal absorption. Approximately 95% of amoxicillin is absorbed through GIT compared with 40% for ampicillin. And so, large amount of ampicillin is unabsorbable, and so it may cause severe adverse effect. It causes diarrhea and pseudomembranous colitis. Why? Because large amount of ampicillin is broad spectrum that kill most type of bacteria, and so gives a chance of other microorganisms to overgrowth, and this is called super infection. What's super infection? It is the chance of microorganisms to overgrowth when I kill other microorganisms. There is a balance between microorganisms in our body, in our intestine. When I kill some of them, the other become or have the chance to overgrowth, and this cause super infection, and this super infection cause diarrhea and pseudomembranous colitis. So I prefer when this chemotherapeutic agent can be taken orally, I prefer the chemotherapeutic agent that has large amount of absorption, or the chemotherapeutic agent that has better GIT absorption. This is to avoid diarrhea and pseudomembranous colitis. Absorption of most oral penicillin is impaired by food, and they should be administered at least 1 to 2 hours before or after a meal. Penicillins are hydrophilic. As I told you, they enter the cell through purines, and so they have extracellular distribution and don't cross blood-brain barrier except in case of meningeal inflammation. In case of meningeal inflammation, this purine become wide and let the penicillin to enter into CNS, to enter or to cross blood-brain barrier, and so that is why I use penicillin in treatment and not prophylaxis of meningeal infection. Why? Or give the reason or explain why I use penicillins to treat and not to prophylaxis against meningeal infection. You know the answer? Penicillins are not significantly metabolized and excreted unchanged in the urine, mainly by active tubular secretion via the acid secretory pathway. This active tubular secretion need energy and the carrier. All acidic drugs have acidic carrier, and all alkaline drugs have alkaline carrier. And so when two acidic drugs are present in our body, they are compete for active tubular secretion. When I use penicillin with propanicid is an acidic drug used in treatment of gout, so both compete with each other for active tubular secretion. In this case, propanicid enters the urine and the penicillin trapped in our body, and this prolongs the action and prolongs the duration of action of penicillin. So it is good combination, penicillin and propanicid. Propanicid trap penicillin in our body, and this give the chance or give chance for to penicillin to be more active and to act for prolonged duration of action. So penicillins not metabolized and excreted unchanged in urine, mainly by active tubular secretion 90%, and to laser extend through glomerular filtration only 10%. So the dose of penicillin must be or should be reduced in renal impairment because it depends on renal excretion. So in case of renal impairment, I must adjust the dose of penicillin, and any drug depends on renal excretion. This is the learning moment. What's chemotherapeutic agent? I ask you. What's the classification of chemotherapeutic agent according to spectrum, according to the effect on bacteria, according to the mechanism of action? What's beta-lactam chemotherapeutic agent and their mechanism of action? What's the type of penicillin? This is question you must ask yourself, and you should give the solution, give the answer for this question. Thank you.